the next section, the eye. We have eye, we have a pair of it, and each eye has 6 muscles in it. Just like on each side, we had 5 vestibular organs, 3 semicircular canal and 2 otolith organs. 5. We had on the one side 5 end organs for the vestibular system. We have 6 muscles for an eye. Okay, lateral, medial. It is a pair. Okay, it's like your bicep and tricep. If you have to lift something, your bicep has to contract and tricep has to extend. Okay, then what happens if the eye has to move towards one side? One muscle has to relax and the other muscle has to contract. Okay, like excitation and inhibition here. You have superior and inferior rectus. Rectus means long muscle. Okay, rectus means long muscle. That's why it's named. Based on the position, it is mentioned. Lateral means towards your side. Okay, medial means towards the center. And your above, the muscle above is superior, below is inferior. And you have other 2 muscles, superior oblique and inferior obliques. Okay. Okay. So in the eye, you have, this is the main, this is the mid one. This is your lateral one. These 2 sides are lateral. This is the mid. We have 4 muscles, which is rectus. 1, 2, 3, and 4. Likewise, 1, 2, 3, and 4. These 2 are medial rectus. These 2 are lateral rectus. These 2 are superior rectus, and these 2 are inferior rectus. Okay. Along with this, we have 2 other muscles, which are oblique muscles. Why it is called as oblique? Because it doesn't really act in one direction. Okay. Let's imagine what happens if this muscle is contracting. This muscle is relaxing. My eyes will go up. Okay. If this muscle is contracting and this muscle is relaxing, I will look down. Okay. If I'm looking towards this side, what happens? This muscle is contracting. Okay. This muscle is contracting. This muscle is relaxing. Likewise, this muscle is contracting. This muscle is relaxing. Okay. This is like, horizontal and vertical movements. But the oblique, superior oblique and vestibular and the inferior obliques will actually turn the eye like this. It is going to turn it. It is called as torsional movement. Okay, the eye is not moving like this, horizontal or up. It is actually moving like this, torsional. Okay. So this is actually in correlation with your vestibular system. So your semicircular canal and your muscles are all connected. How? As I told you, the horizontal, what is responsible for the horizontal movement of the eyes? Lateral rectus and medial rectus. For the vertical, you have superior rectus and inferior rectus. And for torsional means rotation. Okay, the superior oblique and inferior oblique. Okay, coming into the connection between the semicircular canal and the extraocular muscles. This is called as extraocular muscles, which means it is outside the ocular. Ocular means your eyeball. Okay, this muscle is outside it. There is no muscle inside it. It's outside it. Okay, so that's why it's called as extraocular muscles. Fine. The most easiest one and the most important one is your horizontal. That's why it is always kept in the front. Okay, the most easily understandable one, which means if there is some movement in the semicircular horizontal canal, okay, horizontal semicircular canal, you will have the lateral rectus and the medial rectus responding it. Okay, if there is a movement in the anterior semicircular canal, that's where the complexity starts. It is not exactly the superior and the inferior rectus, but your inferior oblique and superior oblique also comes into picture, which means when there is a movement detected in the anterior semicircular canal, the eye not only goes up and down, it is also rotating. Okay, remember, when there is a movement in the horizontal canal, okay, horizontal semicircular canal, the movement is only right and left. There is no rotation. But when there is a movement detected in the anterior or the posterior semicircular canal, because of the involvement of the inferior and superior oblique, not only does the eye move up and down, it is also rotating inside and outside. Okay, inside means towards the medial section, outside means towards the lateral side. Okay, is it confusing or is it okay? Should I repeat? Okay, okay, I will first complete this extraocular muscles and then I will go to the blood supply. Okay. Okay. Now I'm turning my head to the right side. Okay. What actually happened? Which semicircular canal responded? Not anterior, not posterior, but horizontal semicircular canal responded. So what exactly happened? The horizontal canal responded, but which one was excitatory and which one was inhibitory? I turned towards the right side. So the right side is excitatory. The nerve firing increased on this horizontal semicircular canal because I turned towards this side. And this semicircular canal on the left side, horizontal semicircular canal on the left side, is going to inhibit because the movement will be away from the utricle. Okay, if I'm turning like this, okay, the response in this ear will be inhibitory because it is away from the utricle. For this, it will be excitatory because it's towards the utricle. Okay, and then what the eye has to do now, it has to match with the horizontal semicircular canal because both are on the same plane. For the horizontal movement, I need only two, I mean, the four muscles, right? The lateral rectus and the medial rectus. This is enough. Okay, but when there is a movement like this, the anterior semicircular canal and the posterior semicircular canal is getting stimulated. Okay, it is not what actually we will think when we did like this. These two responded, correct? When we do like this, which two should respond? This two will respond. This four muscle has to respond. That's how we will understand. But actually, it is not the case. It is actually your ipsilateral, which means one side superior rectus and the other other side. This is actually ipsilateral, your superior rectus, and the inferior rectus is involving. So if I'm doing like this, okay, one side is contracting, this one is inhibiting, which means relaxing itself. But on the other side, it is not the rectus muscles that respond, it is the oblique muscles that respond. Okay, which means the eye will turn. That's what they are telling. Is it still confusing? If you have to put it in simple terms, concentrate on the horizontal ones. When there is a horizontal movement, it is a linear motion, it's a simple ones. Okay, there is no torsional movement. If there is an anterior and posterior semicircular canal movement, the detection is from the anterior and the posterior semicircular canal, then we are going to have not just linear movement, not just up down, it is going to be a rotation of the eyeball also. Just a simple formula. Horizontal is easier, which means right and left. Most of the time we are concerned with the horizontal ones only, because in the ENG we will be looking at the movement right, left, up, down. That's it. The torsional movement is not recorded, however, because there is no electrode which records the torsional movement, because we can only look at the video that the eye is rotating, but we cannot really record it as in the ENG graph. Okay, so you really don't need to concentrate on the torsional movement. For now, just understand that there are 6 muscles in the eye, and these 6 muscles are actually connected with the 3 semicircular canals, or the 6 semicircular canals together. You have 12 muscles all together in the head, 6 on one side, 6 on the other side, and you have 10 end organs for the vestibular and organs, and you have 6 semicircular canals together. That's 6 semicircular canals, and the 12 extraocular muscles are connected. Okay, in every direction of movement through the semicircular canals, you will have 4 muscles acting together. Okay, for every single movement of 4 3s are 12, right? So you have 3 semicircular canals. Okay, you have 6 and 6 muscles, 12. So for every single movement, you will have 4 muscles responding. Okay, fine. Someone wanted to deal with the blood supply also. So we have blood coming through the labyrinth. Okay, labyrinth means the combination of your vestibular and the hearing apparatus. Cochlea, semicircular canal, and semicircular canals, all 3, and 2 otolith organs. From the basilar artery, we are going to get branches. Okay, this is like branching. Okay, from that we are going to get anterior inferior cerebellar artery. Okay, AICA. From the AICA, we are going to get again branching. From the several branches, we have labyrinthine artery. Okay. Okay. From the basilar artery, we get a branch called AICA, anterior inferior cerebellar artery here. Okay. From there, we are going several branches. You can see the branch is going away, and you have branches coming inside. So this branch here is called as your labyrinthine artery. Okay. From the labyrinthine artery, we have 2 divisions again. Okay. What are the divisions? Common cochlear artery and the anterior vestibular artery. Okay. So you have 2 arteries coming from the labyrinthine artery. The one is your common cochlear artery, and your, just a minute, and then your anterior vestibular artery. Okay. So from there, from the common cochlear artery, you have again 2 divisions. Okay. What are the 2 divisions? You have vestibulo-cochlear artery. Okay. And from the vestibulo-cochlear artery, you have posterior vestibular artery. Okay. So you can see pointer. Okay. From here, you have branches. We got your labyrinthine artery. From there, you got 2 divisions, this one and this one, which is your common cochlear artery and anterior vestibular artery. When it was coming downwards, you're getting 2 branches here. The one is the vestibulo-cochlear artery. Okay. And then, okay, from there, you are getting your main cochlear artery. It's coming like this. Main cochlear artery, it's supplying the whole cochlea. And then you have your posterior vestibular artery, which again branches so much. Where does it supply? It supplies to the saccule, it supplies to the utricle, it supplies to the horizontal canal, it also supplies to the posterior canal. Okay, we have a block diagram coming at the end. I think that will help you to understand better. Okay, so fine. So this is after we have understood, all these 3 things, we are now going to see how it is actually sending. Just like we have divisions in your cochlear nucleus, we have divisions in your vestibular nuclei also. So you have 4 divisions here. Okay, superior, inferior, lateral, and medial vestibular nuclei. Okay, we have 3 divisions. Okay, so the labyrinth, which means the semicircular canal or the otolith organs, first send the signal, the first order neurons send signal to the vestibular nuclei. From there, it is going to send to the, well, yeah, the labyrinth is sending to the vestibular nuclei. Okay, then the signal is being sent to 2. One is your reticular formation, and then to your oculomotor nuclei. Okay, so this 1, 3, and 4 are all your cranial nerves responsible for vision. Okay, you have your abducens, you have your trochlear, and then you have one more, optic nerve. So you have 3 things. Okay, and you have this oculomotor nuclei sending efferent pathways. Remember, this is not afferent. This is giving command. This is motor. Anything, if there is a nerve that is carrying the sensory information, that is called as afferent. If something is carrying motor input, it is called as efferent. Okay. If you look at the cochlea, what the type 1 fiber send, okay, what is sent from the cochlea is the afferent one. It sends the auditory signal to the cochlear nucleus and the superior structures. And what comes down is your efferent. What it does, it is motor in function. What it does, it go connect to the outer hair cells. Okay, what does it do? It is telling it to reduce the dancing, reduce the movement, or increase the movement. It's giving commands on the motor function. Okay, so here it is an efferent information that the oculomotor nuclei is sending to the extraocular muscles. Okay, so when we look at the vision and the vestibular system integration, the pathway, the simple pathway is labyrinth, vestibular nuclei, from there oculomotor nuclei, then extraocular muscles. This is the simplest diagram, but there are other complex things which is inside. Okay, for easy understanding, we have only included the 3-order neuron. Okay, which is called as 3-order neuron pathway, which means the first one is connecting the vestibular, the semicircular canal and the vestibular nuclei. The second order neuron is connecting the vestibular nuclei and the oculomotor nuclei. Okay, this one is the first order neuron. Okay, this arrow mark connecting this and this. The second order neuron is connecting your vestibular nuclei and the oculomotor nuclei, and the third order neuron is connecting your oculomotor nuclei and the extraocular muscles. Okay, fine. And this is regarding your VSR, the vestibular spinal reflex. Okay, the labyrinth sends here, and then from the vestibular nuclei, it is sending to your spinal cord directly, and from spinal cord to the muscle joints. Okay. Okay. Now we are looking into the important section. We already saw the vestibulo-ocular reflex is important. Today we will see about only the vestibulo-ocular reflex, because the next class we'll be seeing about this only. And when we are looking at the VEMP, we will see about the vestibulo-spinal reflex and the vestibulo-colic reflex. Okay. So this is a simple pathway. As we told, we had 3-order neurons. So from the semicircular canal, we have the vestibular nucleus here. From here, we are going to send it to the oculomotor nucleus, and from there it goes to the oculomotor extraocular muscles. So here, this abducens nuclei. This is, I told you, this is your 3 nerves have nucleus. Okay, so the trochlear, the nerve 3 is very much involved in the extraocular muscles, which means there are 6 muscles in your one eye, and most of it, like 5 of it, is actually innervated by the trochlear muscle. Okay. So what happens here? What is a vestibulo-ocular reflex? The bigger arrow is your head rotation. Okay. The bigger arrow is your head rotation. The head is rotating towards your right side. Okay. Then what happens is your eye is moving towards your right side. Sorry, the left side. That is your vestibulo-ocular reflex. Why do we need vestibulo-ocular reflex? The vestibulo-ocular reflex is a reflex. It is not controllable. You cannot control it. It can be overridden. Okay, which means if I'm turning towards the right side and I really want to see something on the right side, then the saccadic system, the voluntary system will override the vestibulo-ocular reflex, but you really cannot cancel it. The vestibulo-ocular reflex will happen all the time. Okay, so when you're turning towards your right side, the eye will try to bring the eyeballs towards your left side. Why? Because to bring whatever the picture is in the eye, the fovea means uh, fovea is like your mirror. Okay, the retina, the fovea is where the light waves come inside, right? So the fovea means the opening. You can say it's an opening. That the fovea, it tries to keep on the image. For example, if someone is speaking to me in front of, standing in front of me, and suddenly one of my friend comes and turns my head like this on the right side, okay, but I'm speaking to the person. What happens? Suddenly my eye will turn towards the left side. Why? Because I'm looking at the person. Okay, so this is a reflex. Okay, this is when there is an involuntary sudden movement of the head, the vestibular ocular reflex comes into picture and it will try to stabilize the vision. Okay, we saw that a person at the beginning, there was a car moving from right to left. This head was moving from right to left, right? But his eyeballs were also fixed. It was also moving from right to left. So this is not vestibulo-ocular reflex. Okay, the VOR will not happen all the time. Okay, when a person is exactly concentrating on something, what was he concentrating on? He was concentrating on the race car, right? So in the race car, this is saccadic movement, which means you're concentrating on a moving object. Okay, when you're concentrating voluntarily on a moving object, the saccadic movement will override the vestibulo-ocular reflex. Okay, if there is no voluntary fixation, then what happens? You will have your vestibulo-ocular reflex happening. So the eye is programmed in a way that when the head is moving towards the right side, to keep the object under the same location, the image fixed, the eye will move towards the opposite side. Okay, do you understand?